Distinguished guests, ladies and gentlemen, it's a real honor for me to be here today at this wonderful venue and in this terrific backdrop of Bali. And I'm here to share with you some thoughts from a European perspective on the forthcoming transformation of digital healthcare. I should say the slides that I'm going to show you today, I have a number of graphs and data points which will go past quite quickly, but I'll make them available after the event. So don't worry if you don't get a chance to look at them properly. So as my introduction was brief, I'm Lawrence Tallon. I'm the Deputy Chief Executive of Guy's and St Thomas's Hospitals in London. This is one of the largest groups of specialist hospitals in Europe. I'm also a fellow of the Siena European Health Leaders Network, so I aim to offer a perspective across Europe, not just UK. Healthcare, ladies and gentlemen, as a sector, is at a crucial historical inflection point. It's surely one of the industries that matters most profoundly both to individuals and to nations and societies as a whole. Individually, because when a person has a life-threatening or a serious illness, there is nothing that matters more to that person or to their family than their health. And let me just first illustrate this by talking about one patient, a real patient. This is Diana's story. Diana was a 52-year-old female who lived in Cambridge, England. She was a single working parent with 2 teenage sons, and she'd had a history of sun exposure in sub-Saharan Africa. She began to experience regular, very severe headaches and spinal pain. After some delay, she was eventually diagnosed with late-stage cancer that had been caused by a malignant melanoma that had spread to cause a large brain tumor. She had neurosurgery to remove the tumor and intensive chemotherapy and radiotherapy under a clinical trial. This required, of course, frequent long stays in hospital, which were a major worry for her as a single parent of 2 boys. And although the clinical trial was relatively successful and prolonged her life for several more years, she ultimately passed away early in her 60s. So what we see here in this patient's story is quite successful surgery and oncology, but late diagnosis, prolonged time in hospital, huge disruption to family life, and ultimately premature mortality. Now, I just want you to remember that story for now, and I'm going to return to Diana's story later to see how different things may have been in our new digital era. But let me first zoom out now to talk about nations and societies. Healthcare is, of course, incredibly important also at the societal level. In peacetime, it usually consumes more of a country's wealth of GDP than any other area of public spending. What you see on this graph here is, since the 1700s, public spending in the UK remained relatively low for centuries, less than 10% of GDP, only really peaking when there was expenditure on the military for wars. Until we get to the 20th century, where you see this huge uptake in public spending around welfare. And particularly on the right-hand side, you see that the largest single block of public expenditure is healthcare. And this, of course, is a story we see around the world. It is a great success of our public health measures that people are living longer and we are having populations that are aging. But the rise of multimorbidity means that people are often living those extra years with more years lived in ill health, placing pressure on public services. Now, of course, the pressure on public services we know was made much worse by the COVID-19 pandemic, but it was not fundamentally caused by the pandemic, but by aging and multimorbidity. And as demand for those services has risen, as we've already heard, our supply has not kept pace with that demand. Our supply of physical capacity, human capacity and financial resources. And our current model of healthcare is still so reliant on highly trained, expensive people in expensive buildings. And as we've already heard this morning, the major problem we all face is the shortfall of healthcare workers, doctors, nurses, and many other professions. And there's projected to be a 10 million shortfall in healthcare workers by 2030. Now, this, of course, is risky for lower and middle income countries who may lose their workers to higher income countries. It's also risky for high income countries to rely on a supply of labour from outside of their control. And perhaps most problematically, it can create zero-sum competition between nations and regions for this finite resource of healthcare workers. Now, software is not finite in the way that human capacity is. And so digital health offers us a way to avoid that kind of zero-sum competition for healthcare workers. We also know that consumers' expectations of healthcare has changed radically in the recent decades. People want a three-click experience in their lives, just like they do in many other aspects of their life. Now, in the time it will take me to give this short talk, anybody in this audience could make a payment, order a product, or download a movie from almost anywhere in the world. You may even be doing that as I speak. But the barriers to access and communication in healthcare remain far too high. And we have to keep pace with 21st century expectations of our patients and our citizens for how they want to access services. It's also far more effective and cheaper if we can activate that power of patients and citizens to manage their own health, whether by using technology or not. And of course, there are a plethora of apps out there to help people manage their health. Now, some people might say that not all patients want to use digital channels for healthcare, and of course they're right, not all patients do. But our experience at Guy's and St Thomas's has been that there is a huge appetite for patients to take greater control of their own healthcare. Since we went live with our new patient portal, MyChart, in October of last year, 400,000 patients have signed up and opened an account. That's one every minute since last October, 24/7 around the clock. And as you can see from the age distribution on the right-hand side, this is across all age groups, of course more in the younger age groups, but many people in their 70s, 80s, and even 90s have signed up for an account. The number of patients not attending their planned appointments has dropped by 2/3 since the introduction of this portal, because patients can book around their own choice and convenience. And 1.7 million tests have been reported to patients directly through the portal. So significant progress can be made in a short time. But if I recap the wider international picture, we see the clear trends of rising demand, limited affordability, and unmet expectations. And this is creating unsustainable pressure. So I would put it to you that the risks now of the status quo in healthcare are even greater than the risks of attempting fundamental digital transformation, provided, of course, we manage those risks, and I'll come on to that later. Recognizing this unsustainable future and changing its course is a job of leadership, and that's the job of all of us in this room. I often say we need to have our feet rooted in the realities of today, because, of course, it's difficult to ignore patients queuing up in the emergency department that we often experience. But we also need to have our eyes on the horizon to plot a better path for healthcare in the future. And as we look to the middle decades of the 21st century, all leaders need to be thinking digital first and need to be tech savvy, not just seeing this as a job for the CTO or the CCIO. This is a job of all of our leaders. So the need for change is undoubtedly here, and so too now is the opportunity. Healthcare is ripe for transformation in the digital era to follow the leads of other sectors. And you can see here that healthcare is one of the least digitally mature sectors compared to things like media, financial services, and retail. So we have a long way to go, but a lot of opportunity. On the right-hand side, I conducted a survey of healthcare leaders about a year ago, asking where do they think the productivity gains are going to come from in healthcare. Now, about 89% felt that in the next 2 or 3 years, the gains would come from getting more productivity out of the existing model of care. But over the next 10 years, 100% of those leaders surveyed felt that they would come from transformative digital technologies. So the technologies are now available for us already to reimagine how we provide healthcare. And these are just some examples from hospitals like mine, but not always apply consistently. Dockler is a virtual inpatient ward solution that's reduced our need for acute bed days by 30% and has a huge patient satisfaction level of 97%. Careology is one of the #1 apps for tracking and monitoring symptoms for cancer patients so they can take greater control of their care outside of hospital. And AutoSeg CT provides AI-enabled contouring for radiotherapy, which is 12 times faster than trying to do it manually. So these technologies can make healthcare better, faster, and fairer, whilst also driving a step change in productivity. And now that the technologies that we see are maturing for us to reimagine healthcare, we can see that the potential for this to radically increase access in lower and middle income countries is really growing exponentially. With the spread of mobile internet and infrastructure, we can see the opportunity to radically increase access across the world to healthcare. But so far, healthcare has remained stubbornly resistant to digitally enabled change. Health tech is often pushed by commercial providers rather than pulled by healthcare providers according to their needs. So we need to think very carefully about where do we invest our time and our effort in terms of choosing the right technologies. This is a slide, it's quite detailed, so I'll share it for you afterwards. Some work we did at Guy's and St Thomas's to look at how mature technologies are and how easy they are to implement, and also the size of the bubble indicates the size of the opportunity. And what you see in the lower left quadrant is there is a lot of health technology that is very mature, often applied to non-clinical services, quite low risk and easy to implement. And we need to seize these opportunities. Not all healthcare has to be the higher risk clinical decision making, although of course we will get there as well in due course. But carefully selecting our technologies is really only one part of this journey, and perhaps not even the most important part. Perhaps the most important part is change mindsets and change management. This graph shows some work that was done by MIT that looks at where companies invested in technology and in change management. Now, in the top right quadrant, the companies that were most successful invested both in technology and change management. And bottom left, those were the least successful. But if you have a choice between just investing in technology or change management, actually, you're better to invest in change management technology, because technology cannot change healthcare on its own. Only people can use technology to change and improve health systems. So let me now offer a few practical suggestions for how we can get these changes enabled effectively and also manage the risks. Well, clearly on the technology itself, as I've already said, we need to be looking at the demand that comes from healthcare professionals and health systems, not just the push from health technology companies. We need to match those things together. We need increasingly to be looking at platforms that can integrate multiple technologies that are interoperable. We know that there is an absolute wealth of solutions out there, but often it's very difficult as a healthcare provider to knit these together in a way that works for our healthcare workers. We need to be really careful to avoid the hype that comes with new technology. Yes, and you've heard me say today, this offers a fantastic opportunity in the decade ahead, but we also need to be practical and careful and not just assume that technology will automatically make things better, and avoid this venture capital bubble that often encourages tech companies to overhype their technology. And I would also say, having suffered recently in my part of London with a major cyber attack, we need to take our cybersecurity incredibly seriously and not assume because we're in healthcare we won't be a target. In fact, we may be a greater target. The trust of our patients and our citizens is crucial, and this needs to be built through deep public engagement with our citizens, with our patients, and so that when we apply AI, we do so responsibly with the consent and the trust of our patients and our citizens. And some of that trust comes by avoiding the biases that we know can be built into data sets that get amplified as solutions get rolled out. Often data sets are trained on American or Northern European populations and may not work so well for Asian and African populations. So we need to be really mindful of these biases. There needs to be strong accountability for decision making. So the more and more that we rely on computers for decisions, the more important it is that we are absolutely clear where ultimate accountability lies. We need to be able to explain to our patients how decisions have been taken, and we need humans in the loop so that the computers and the algorithms aren't working outside of human supervision. We need to be exceptionally careful not to disempower the most important people of all, our clinical workforce. As I've already said, I think this is fundamentally a job of leadership to look to what is possible over the decades ahead and not get stuck in the status quo. And that can only happen with deep clinical involvement, ownership, and engagement across our organizations. And we need to be really careful to reskill and retrain those people whose jobs will be changing in the digital era so that they don't hold us back from change, but they actually support and lead change with us. And lastly, we need the right policy incentives in place. So I was delighted to hear earlier a move towards capitation payments so that we are thinking about preventative healthcare, not just fee-for-service to increase the volume of healthcare, but we're thinking about the value of healthcare. But we often find that policies around payments and regulatory systems move behind the pace of innovation, and we need them to catch up. And we should not assume by any means that because we are currently the leaders and the incumbents in our organizations, in our countries, in our regions, that we can take that for granted. If we look over the last quarter of a century, at the 15 largest companies by value, almost all of them have changed in that quarter of a century, driven by the growth of new technology and the huge valuations of tech companies. So incumbency, current leadership cannot be taken for granted. History shows us if we do not lead, we will be bypassed. Let me briefly now come back to the patient story I started with at the beginning of this talk. And I've tried to show through this short talk at the macro level why digital transformation of our sector is both essential and attainable. But let me come back to why this matters at a personal level. Now, you'll recall Diana's story. How might it have been different in the digital era? Well, perhaps she would have had a smartphone to take an image of that troublesome mole and send it in for an AI assessment to categorize the risk and triage her to the right place. If she couldn't take time off work, she could have had a virtual consultation with a clinician informed by that data from the smartphone image. She would have been able to, after diagnosis, manage her own care pathway much more effectively, monitor her symptoms through the Careology app. She could have managed her multiple interactions with the healthcare system for her own convenience with the MyChart app. She could have shared the information that was available to her, not just in the clinic room, but on a digital repository that she could share with her family or people caring for her family. When she needed radiotherapy, it would have been far more precise and far faster with the auto-seg-CT. And her medical oversight could have been provided often remotely so that she didn't have to spend quite so much time in hospital, far less disruptive for her and her family. And maybe even she would have been had available advanced cell therapy supported by AI analysis to really personalize treatment to her particular tumor and cancer type, and even to reverse cancer and not just manage it. Now, why does this matter so much to me? Well, Diana was my mother, and this is why I do the job I do. And I know you will all have stories from your own family about why you do the jobs you do. And I believe we can do so much better for the patients we serve in future using these new tools and technologies available to us. So I'm going to close now with just one final reflection. I do believe we have really good reasons for optimism. Healthcare always gets better over the long run of time, even if it has short-term reversals for things like the pandemic. And it gets better because of new technologies and human ingenuity, just like the ingenuity we have in this room. There's no doubt in my mind that people will harness the digital and biological tools currently available and invent many more. Crucially, the growth of digital technologies has the potential to lower unhealthy competition between countries and regions for healthcare workers. So I believe we can offer our people credible hope for healthcare that is better, faster, and fairer for all. And I would suggest to you, it isn't a question of whether digital transformation of healthcare will happen, but where and when. I wish you an incredibly successful conference. Thank you again for having me.